Hello, everyone, and welcome to the Industry Matters podcast presented by VGM. Each episode, we feature conversations with leaders, innovators, advocates, and everyday people who are working to strengthen patient care, support business operations, and shape a sustainable future for the DME POS, CRT, home access, and broader home healthcare space. At VGM, we believe that knowledge moves the industry forward. Our goal is to give you real insights you can use, whether that's navigating industry challenges, improving patient care, or strengthening your business.
Alan, thanks for joining me today. Happy to be back on the podcast. Today we're going to be talking about something that is reshaping the entire U.S. healthcare system. We're going to be talking about the rising burden of chronic disease and what that means for the DME industry. As a reminder, just off the top here to those listening, a lot of the different topics that we talk about on the podcast, we have a library of content on our VGM member portal where you can go to see more of this information through some organized reports, data, and insights that we've gathered under the Industry Insights library of content. So we're going to keep it high level for the purpose of Alan and I's discussion today, but there's a lot deeper deliverables and whatnot on the member portal. So today's topic, as I mentioned, is chronic disease. Alan, we're really going to be talking a lot about the rise of prevalence across a couple different specific chronic conditions. The ones we're going to be talking about today are obesity, diabetes, COPD, and congestive heart failure, and what the rise of those different conditions means for the DME industry. As we both know, Alan, these conditions are not new, but what we are finding out to be new is just the scale and persistence that we're seeing across the board of the number of people in the United States that are utilizing the healthcare system, and also how these conditions are managed. A lot of these conditions are not things that you just get treated one time for and it goes away. They're things that continue to linger on over time. And also what we're seeing is the way that these conditions are being managed is shifting to the home. And today we really want to talk about what that shift has to do with the implications for the DME industry. Alan, do you want to start us off with what you see as the key kind of trends when it comes to chronic disease and how that is having significant implications for DME?
Yeah, absolutely. Thanks, Tyler. Happy to be here. Good to see you. This is an important topic. It's one I think we both get asked about a fair amount. I look forward to kind of diving in a little bit deeper into the growing prevalence of chronic conditions, really, quite frankly, in the face of growing availability of certain drugs that are designed to combat these chronic conditions, which we'll talk more about as we kind of go through the podcast here. But overall, the modern U.S. healthcare system really is becoming less and less dominated by like short-term episodic care, and really is increasingly defined by the conditions that we're here to talk about today, those that progress over decades and require daily management over long periods of time. So less about 3, 4, 5-day hospital stays, more about how we manage patients to the point where they don't end up in the hospital, preferably in the first place. So obesity, diabetes, COPD, heart failure are really the backbone of healthcare utilization. Conditions, obviously, that don't resolve. They accumulate over time, and they tend to reinforce or compound one another. So what it means from a DME industry perspective is that care, as I mentioned, shifting away from hospitals and more into living rooms and home offices. So managing these chronic illnesses that I mentioned and others requires equipment, monitoring, long-term support, which is, fortunately for us that are in the DME business, exactly where our industry comes in. So at this point, I think DME providers, for a myriad of reasons, but especially for the growth in chronic conditions, DME providers need to look at themselves not as a downstream service, but rather as a foundational layer of the chronic care ecosystem. So as payer incentives push care out of acute settings and into the home, DME providers become essential to keeping patients stable, functional, and out of hospitals. And to that point, the payer incentives pushing care out of acute settings, well, that's not what we're here to necessarily dive deep into today. I'd again piggyback on what Tyler mentioned a couple minutes ago. Go out and check out the Industry Insights library of content, and we've got some really detailed content about the payer incentives and adjustments in payer incentives that are more and more aligned with management of these long-term conditions and less aligned with that short-term episodic care that I mentioned.
Yeah, I think that's great background info. And as I mentioned, let's get into talking about what some of these different chronic conditions are. We decided that we'll start with discussing obesity, really because when we think about obesity, it acts as a demand multiplier across every other chronic condition. So the really important piece there is just understanding that those that have obesity, it's rarely in isolation. There's evidence that shows it increases the likelihood of several other conditions such as type 2 diabetes, cardiovascular disease, sleep apnea, and other respiratory issues. And from a DME standpoint, that's really important to understand because obesity will be one of those conditions that drives demand directly and indirectly through other conditions as well into the future. We've gathered some data that shows that roughly 40% of US adults today have obesity, but we are expecting over the next 2 decades or so that this will creep into the 60% range. So that data just really validates how prevalent this type of condition is going to be in the future. Another thing about those who are living with obesity and obesity related conditions, as you mentioned, Alan, these are things that last a long time, potentially years and years and decades of a patient's life where they can be trying to figure out how to best manage these different conditions, which really turns into more of a reliance on the equipment and services that DMEs are providing. As it relates to obesity, a lot of the data that we'll be continuing to monitor in the future is obviously the impacts that we hear about related to GLP-1 therapies. What we've come to find out there is that at this time, there are some studies and things that show the impact of GLP-1 and how they can be effective with weight management. But at the same time, we know that obesity is not just going to drive growth into the future. There's also a structural floor that it creates there with patients that are still going to need equipment due to other medical factors that might be in play outside of just what their weight is. But that's something definitely that we'll continue to keep monitoring, understanding what the data is telling us moving forward. That's a rundown on obesity as a chronic condition and the demand driver there. Alan, do you want to build on that with discussing diabetes and kind of the whole GLP-1 conversation there as well?
Yeah, absolutely. Thanks, Tyler. Yeah, diabetes, there aren't really any chronic conditions necessarily that probably drive equipment utilization over a long period of time, more so than diabetes. So today, we know that about 40 million Americans live with diagnosed or undiagnosed diabetes, representing about 12% of the population, pretty substantial. Another 115 million classified as pre-diabetic, so trending in that direction, which means that honestly, between those two numbers, almost half of the United States is either diabetic or pre-diabetic at this point. Not a good thing for us as a population, but certainly a driver of demand for those in the DME industry. So diabetes is fundamentally normalized home-based disease management. Continuous glucose monitors, insulin pumps, and supporting supplies are really part of everyday life now for tens of millions of people. From a DME perspective, diabetes is really less about any single device category. While obviously CGMs, insulin pumps, whatnot are directly connected to diabetes, it's less about that category and more about cumulative demand over time. So as disease duration increases and certainly severity increases, so does the layering of equipment. So not just CGM and insulin pumps that I mentioned, but also mobility devices, wound care, and even renal related equipment, which is creeping its way into the DME industry more and more. So as patients age into Medicare, especially long-term care, these patients favor DME suppliers that have scale, payer expertise, and operational sophistication to really be a partner within the healthcare ecosystem and manage large populations with a whole lot of needs. So diabetes doesn't generate that one-time demand like some other DME products. It's really, like I mentioned, decades of predictable utilization. So you mentioned GLP-1s as well, and I kind of want to touch on that. We get tons of questions about GLP-1 impacts, sleep apnea, CPAP market, diabetes market, all of the above. Again, another plug for Industry Insights. I know you just put together some content that speaks specifically about the relationship, or the comparison, I should say, between CPAP and GLP-1 and their effectiveness for managing obstructive sleep apnea as a first line of defense out on the Industry Insights portion of the VGM website. So those of you listening, go check it out for more detail here. But, well, long story short is, while no one has a crystal ball, multiple studies have indicated that the prevalence of both diabetes and obesity will increase. And those studies even acknowledge the growth of GLP-1s, specifically one from National Institute of Health, federal government branch that does a whole lot of studies or publication of studies on long-term implications of diseases and drugs and other things that impact healthcare industry. They've got a study published that suggests the prevalence of diabetes in the United States rise from the 12% that I mentioned already today to closer to 15% by 2045, indicating that while the drugs clearly work for those who take them, diabetes and obesity for that matter aren't going away. It's unfortunate for the population, as I mentioned a minute ago, but points to a clear need for the DME community. So along the lines of CPAP, I know you just published the Industry Insights document that I mentioned. The practical takeaway of that document, or the studies in general, is clear, is that CPAP remains the most reliable and immediate treatment for moderate to severe OSA, while GLP-1 medications can meaningfully reduce severity for patients whose sleep apnea is driven by obesity. The best outcomes come when both therapies are used together. There's no study that I've seen, and I think, pride myself on being objective in nature, so trying hard not to be biased here, but there's no study that I've seen that suggests that there's going to be a material decline or decline at all in CPAP utilization. So GLP-1s will undoubtedly change the sleep landscape. There will be some patients who see reduction in reliance on CPAP devices, but more individuals are likely to be diagnosed and treated earlier just because the GLP-1s are opening up conversations with doctors in a way that maybe hasn't been the case before, which is a subject that I know you, Tyler, and I have discussed in the past. So CPAP's not going away, CGM's not going away, really augment the therapies along with GLP-1s.
Yeah, great takeaways there. And as you mentioned, Alan, we have some more data and statistics and things like that on what those studies are telling us and how we've been informed in that space so far as well. The next topic that we're going to be discussing relates to COPD. So really understanding that COPD is one of the conditions that has really shifted to the home in terms of how this is managed. COPD is something that affects roughly 5% of U.S. adults, and prevalence within this category is something that we see that continues to increase as patients age. Smoking rates have declined. We do have data that supports that in the sense that the prevalence of this condition is really going up more toward the aging demographics and maybe past exposure to smoking and other factors like that have allowed this condition to be something that has remained persistent in terms of growth. But really the big takeaway here is that COPD management, as I mentioned, relies heavily on being able to have home-based respiratory support, whether that be oxygen concentrators or non-invasive ventilation. But on the other side of that, to your point earlier, Alan, we know that health systems are incentivized financially to reduce hospital admissions, readmissions, and length of stay. So really just understanding how important it is that care that's taking place in the home to manage a condition like this, having that alignment and data to be able to show that it helps prevent readmissions or hospital admissions and drives up quality of care is really big, because COPD patients often have frequent exacerbations, which can lead to reoccurring equipment use, needs for replacement cycles, and things of that. Definitely understand that the DME industry is in good position to capitalize on respiratory care being one of the most clinically necessary, but there's also the financial necessary needs of what health systems are seeing when it comes to being able to manage populations across the board. And they're doing that through prioritizing prevention and care in the home through the utilization of this type of equipment.
Yeah, absolutely. CHF, congestive heart failure, is another resource-intensive chronic condition in the United States as well, and one that's not declining much. Diabetes, where a lot of crossover in utilization of equipment attached to comorbidities, things of that nature. So today, we know that just shy of 7 million people in the United States live with heart failure, a number that's expected to grow. Projections suggest that number could creep up to closer to 9 million over the next really only 5 years or so, largely attached to obviously being an unhealthy population and an increasingly unhealthy population, but also an aging population. So anticipate the growth of CHF to be fairly rapid over the next 5 or 10 years. But it's also a leading cause of hospitalization among the aging population, Medicare beneficiaries, Medicare Advantage beneficiaries, and it's closely intertwined with obesity, diabetes, hypertension, like I mentioned a second ago. So heart failure management is where the big deal comes in for DME. Is heart failure management doesn't end at the point of diagnosis or at the point of hospital discharge. That's really where it begins. There's daily weight management, oxygen therapy, sleep apnea treatment, mobility assistance, short-term home medical equipment, a whole bunch of things that are core elements of keeping patients stable after a hospitalization, or even as a mechanism for preventing a future hospitalization. So again, it's where DME plays a critical role in post-acute and transitional care. Hospitals are penalized for readmissions, like you mentioned. They're incentivized to keep patients out of the hospital through ACO or other value-based care arrangements, meaning reliable home medical equipment and home medical equipment partners become a clinical and financial necessity within the healthcare ecosystem.
Absolutely. Yeah, we always to close here with kind of some tangible takeaways on what this means and for the DME industry. So taken all together here, as we've alluded to several times, the prevalence of these conditions is really enforcing the demand that's out there and the need that's out there for DMEs. And the things that we're talking about here today, these aren't elective services. These are things that people are tasked with having to manage for long periods of time. And the thing about chronic disease and the demand associated with this is it's resilient through things like policy change, economic cycles, and things of that nature, because patients in some cases truly need this equipment that's associated with these conditions to have daily function and for medical necessity reasons. Because of that, we like to see that as supporting the 5 to 6% overall market projections that we're seeing for growth within the industry, and really tried to highlight today as much as we could in terms of how chronic disease does its part to drive that. But really, I think one of the biggest pieces from a strategic standpoint is just understanding that these conditions are only going to grow in prevalence, and that is really what continues to drive payment and incentive across the healthcare ecosystem that's non-episode based, whether that be the hospital readmission reduction program that I had talked about, ACOs, bundled payments, and really just managing population health as a whole. The strategic takeaway there is that we encourage DMEs to understand that to capitalize on growth and demand within this space, having that vertical alignment with those health systems or payers on what their incentives are is really important. And well into the future, it's only going to become more important. So if you have any questions on what that could mean for you or your business, please don't hesitate to reach out to Alan or I. We're happy to internally help you understand that from the subject matter expertise that we have here at VGM. But really, the big takeaway as well is as the health of the United States population continues to have more of these conditions, DME is going to be something that's going to be right there to help support care delivery and manage them all across the board. Alan, any other kind of thoughts that you have in closing at all?
No, I think you said it well. It really is. There's this first piece that's the rise in prevalence of chronic conditions. These conditions aren't going away anytime soon. That's driving the need for evolutions in how payers incentivize providers trying to get care away from these short-term band-aid treatments of hospitalization, things like that, but rather like long-term chronic care management, keeping patients out of the hospitals, keeping them out of skilled nursing facilities as long as possible, ultimately keeping patients in their homes. So one drives the next, which ultimately drives not just growing demand for DME like you suggested, but growing demand for DME to play a more integral role as a vertically integrated partner within the healthcare ecosystem, which is something we've talked about a bunch. But the point of this is that this whole conversation is that it's really all driven at its core by continued demand driven by continued prevalence or growing prevalence of these conditions. So yeah, that's demand for DME is not going away.
Absolutely, yeah. And as we've alluded to a couple times, if you have any questions related to some of the content that we've put together on the Industry Insights Library as you're interacting and understanding some of those deliverables, as always, feel free to reach out to one of us and we're happy to get those questions answered and look forward to our next episode.